potential root canals and crowns and thousands of dollars worth of treatment that could have been prevented if they just didn't have that silver filling in there in the first place.
And not to mention the damage it's doing to the rest of the body. I mean, do we know anything about the exact effect is the word, of mercury on things like the cardiovascular system and the nervous system, things like that?
Well, we do. There's a whole list of problems, and I can go back. Of course, everybody now is worried about autism and everything else with their young kids, to Alzheimer's, and we can go through half this list. But if you were to Google it again, you'd be amazed at all the concerns with mercury. But it can cause everything from eye problems to nerve problems, nephrotoxic. We keep going to just irritations of the skins. Obviously, it's causing irritations of the vascular system, the lungs themselves, and the biggest problem we talk about is mercurialism, when the mercury levels get extremely high, and the symptoms are different, but they're listed here, including tremors, salivations, stomatitis, loosening of teeth, blue lines on gums, pain, and numbness in extremities. A lot of neuromuscular issues going on. I think the list is so long that that'll be a whole night of just talking about it by itself. And I by no means claim to be a mercury expert. I more just say I know it's a problem. It's obvious it's a problem and why, and it just should be removed. And the really interesting aspect of this is some of the results we've seen with patients again as they have their silver fillings removed. My wife had a hyperthyroid, and she actually was not taking her medication at the time and wanted her silver fillings removed just for a cosmetic reason. We removed her silver fillings. Next time she went back to her physician and checked her thyroid levels, everything is self-regulated. Her thyroid was normal. I've had patients that had debilitating headaches again, took out the silver fillings, and she waited a year to write me the letter. She said the very next day after you removed these silver fillings, I did not have a headache since that day on for an entire year.
Really?
We have a patient that's our patient. We didn't actually do the treatment, but she was seeing a dentist in Atlanta at the time. It's another dentist who's real big anti-amalgam. They removed all her silver fillings, and she had lupus, and her lupus went away. And they're documenting the case. They did all this research on it. I never finally asked her what happened with it, but I have that dentist's name, and I've always meant to contact him to see his results.
Dr. Luna, what's being done to let physicians in other fields know that maybe they should check out what's going on in someone's mouth?
You just hit the biggest sore spot of all with me. This is something we don't really get to talk about. You're not going to see me write about it much. The dental board in Alabama doesn't like it when I say anything about it. The American Dental Association is not real keen on it either. It's been difficult to say a whole lot. You put it in print, and then they come in after you, and they're trying to find you. I mean, they've tried to find me many times.
So it's the dental industry itself that's stopping the information getting out to other medical professionals?
Correct. So that's why I like to go and lecture and talk about this as often as I can, just so people know.
Right.
Now, there's no way now that like the state board here or the American Dental Association can say much to me, as the FDA just came out with their release a week ago, and I'll say, hey, look, the product's no longer considered a low-risk product. It's a moderate risk, and that's in my patient's behalf. I have to let them know.
Well, we'll just get this webinar recording out to them all.
That's
right. Right. Now let me ask you this: if once the filling has been removed and replaced with something safer, does that automatically mean that the body's going to get rid of all the mercury that has already leached into the system, or there's something else that needs to be done where that's concerned?
From the silver standpoint, silver filling standpoint, pretty much yes. I'm going to bring that up in just a second.
Okay.
The other thing that most dentists and people will argue with me is I tell them that silver fillings leak. You know, it's one of the 3 reasons why I said this product should not be used anymore. So for most dentists, they're going to look at these silver fillings here, and they consider those normal fillings, no problems, small fracture lines. And when we take them out, you can just see all the black and all the issues that are going on underneath it. Another example, this is a person that just wanted their silver fillings removed for cosmetic reasons only. We took the fillings out, and we found big cavities, huge cavity, huge cavity. You know, and they never would have known these would have continued to grow underneath the silver fillings. Eventually would get to the nerve of the tooth, cause a root canal, then end up needing the root canal and crown and all the pain that goes along with that. A lot of unnecessary expenses.
Again, it's the mercury leaching out of the filling that's causing the cavity. Is that what you're saying?
It can be. The mercury itself, I have a feeling, is destroying the nerve in the tooth and causing the nerve to die.
Okay.
But also from the standpoint of the tooth, the restoration expands and causes the tooth to crack, or when it causes these cracks, then the bacteria can get in between the cracks and get underneath there and start a cavity. Besides the fact that one of the reasons dentists always like the product, as we mentioned before, is they said, well, we can put it in a wet environment. So from the very beginning, they left saliva and bacteria underneath the filling. And so those are all reasons why these cavities are underneath there.
I have a question from one of our attendees saying, Dr. Luna still refers to silver fillings, but in reality, there's no silver in amalgam fillings, correct?
No, that's not true. There is still silver in them. Yeah, 50% of the filling is mercury. The rest is made up of products such as silver, tin, copper, nickel, and zinc.
And do those also have problems, or are those are relatively safer than mercury, right?
Well, I mean, silver can obviously be somewhat of an issue. One of the big ones that's in there is nickel. As I've read reports saying that 20% of all women are allergic to nickel. So if you're a woman and you sometimes buy cheap jewelry and you have a reaction on your ears to it, most of that cheap jewelry has nickel in it, and you might be allergic to it.
Okay. I have been diagnosed with chronic fatigue and have recently been told that my brain fog is probably from my fillings. Would you agree with this?
I still have a hard time saying with 100% certainty, sure. There's a lot of other issues that can be going on, so I'm not going to say that just by removing our silver fillings we're going to cure the world. But it definitely can be a contributing factor, and as I continue to remove silver fillings and amalgam, it's kind of like TMJ. I continue to get amazed at the symptoms or illnesses that people have going away and just in general feeling much better. So obviously who this person is seeing is somebody that's interested in the mercury that's in the silver fillings and thinks it can be a very strong contributing factor. And so sure, I would, from the standpoint of the teeth alone, I recommend getting silver fillings removed. But if you have an issue like that and someone is already telling you that when they want to remove the silver fillings, I would have high hopes that that's going to help.
Okay. And someone's asking what the blackness in the teeth is. That's the cavity from the decay of the bacteria, right?
Yes, it is. That's cavities you're looking at.
Okay. Well, like you said, this is a very interesting topic, and we could go on with that, but let's
keep moving.
Keep moving, yeah.
All right, so
yeah.
one of the, as I said earlier, it seemed like under all the silver fillings I've been replacing, I would find cavity under 80% of them. And that was just a number I was throwing out there just by sitting in my practice and looking. So Las Vegas Institute actually did a study about 2 years ago. They removed 340 amalgams. Under 67% of them, they found cavities. Okay, what was even more interesting is of that 67%, 16% of them had gross decay, meaning by that you could take a little instrument and just scoop the decay out because the tooth was so soft. And so everything I've been saying for the last 12 years, they did a study, and their number, I said 80%, but I wasn't truly counting, They found it under 67%, so it's very close. And so for the questions, what are some of our options? Of course, there's always you take it out and there's cavity, there's always the option of putting another one in there. I hope by now I've shown that that should never be done. Composite is a white filling. That's what you hear most people say, or porcelain filling. It's usually composite. It's a resin-based material. It does not have any of the problems of amalgam. It does not contain any mercury. It does not expand or contract, so it's not going to cause the tooth to break. And because it's chemically bonded to the tooth, there's a seal between the filling and the tooth itself, so it just cannot leak. We have other options, which is gold, and there's nothing wrong with that. Or if they're doing crowns, porcelain fused metal crowns, I really don't do any of that. I try to avoid any metal at all in my practice. And all ceramic crowns. The interesting, I just wanted to throw